Hey guys, welcome back to the channel. My name is Rohan. I'm now a fourth year medical student studying at Cambridge University. And yeah, this is going to be a quick life update style video because to be honest, I'm running a bit late and I need to head off soon. But I just wanted to fill you in because I've recently started clinical school, what it's been like and what type of stuff I've been getting up to. So yeah, I moved back to Cambridge about 3 weeks ago. And now I'm staying in a house, so like our first house, me and four other friends. And yeah, it's been really good. It's been different from living in college because college is basically like a university campus. So there's loads of students everywhere. There's a lot more hustle and bustle because lots more things are going on. Whereas here, we're renting a house closer to the hospital and it's just like a normal place. Like in the middle of Cambridge, like in Robinson, you're just surrounded by all these massive historical colleges. Wherever you go, you also see someone you know. Whereas here, I think the pace of life is just a bit more normal. So we live in a normal neighborhood. There are like schools, like local shops. So in a way that feels good, like because it feels like I'm moving towards a more normal life, if you know what I mean, and not like in the student bubble. So that's been really good. We've been here for about 3 weeks and still just kind of learning how to be an adult. So like paying bills, I don't know, just cleaning up around the house and like figuring out how each of like the machines and the buttons work. Oh, and it's really good that I'm living with friends this year because during my time in college, I wasn't living with many of my close friends. I mean, there were nice people like on my staircases, but it's really nice being like living with my other close friends just because you get like these like chances for more spontaneous conversations and we can invite people around because we have an actual living space as well. Everyone living in our house is a medical student, so we can practice like the patient examinations on each other, like practice using the stethoscope and even like doing combined revision. I think for like the clinical studies, that's going to be really useful. So that's about like living in a house and then having started clinical school. So we started like in start of September, so it feels like actual school, not like university, which tends to, for us, starts in October. And yeah, it's been quite a steep learning curve. I feel like they call it an introductory week, but it's like an introductory 2 weeks. And they like throw quite a lot of information at us, like introducing like the different specialities, also teaching us like core like communication skills, like how to initiate a consultation with a patient. Also like basic practical skills like washing our hands, but also scrubbing into surgery. They taught us something else. Oh, we had to get needles and syringes out, and I was like, I don't know what I'm doing. But hopefully I'll get more chance to learn that, and also practicing or learning the patient examinations. So yeah, there's been quite a lot thrown at us. Like the clinical school facilities has been quite good. Like there's this massive common room so we can all like have lunch together, and it's really fun like playing table tennis or just like catching up with people we haven't really seen since the start of the course, because I guess our year has been affected quite a lot by COVID. So because a lot of our teaching so far has been online, it's really good just to be able to see everyone in person. That being said, there was quite a lot of admin we had to get through, which is a little bit stressful because I felt I was just, not learning enough medicine and just having to fill out lots of paperwork because we have to learn how the computer systems work in like the Cambridge hospital and also in our placement hospital as well. So yeah, lots of stuff to sort out, but in general, it's just got us really excited to start actually seeing patients on the wards. So one thing I've enjoyed about clinical school more than, let's say, university is like it's actually a lot more contact time. So we're usually in from 9 to 5 or like sometimes even longer or sometimes a bit earlier, but it just feels a little bit more professional. Like we have to turn up at 9 a.m. every day, and I know like lots of people actually don't like that, but for me I kind of like that time structure. Technically we're like student doctors now, so we have to be like professional and like turning up in like kind of smart clothes. I don't know, for me that just feels kind of like fun, and I enjoy like wearing like the student doctor lanyard. Makes me feel a bit more official even though I have no clue what's going on. So that's all been quite fun. And we also had the societies fair over the weekend, and that was fun just to see like all the student societies linked to the clinical school. And yeah, I'm hoping to get involved in something or the other. But yeah, there's just a lot of information thrown at us. Okay, and now I'm heading off to Bedford, and there might be some vlogs based in Bedford. Who knows? So basically, as clinical medical students, so that's years 4 to 6, we spend like half our time based around Cambridge, where we get teaching from the clinical school, but we also head into Addenbrooke's, which is like a major tertiary centre, so quite a big hospital. But we also get put on these placements into like district general hospitals around like the East Anglia region, or like anywhere kind of near-ish to Cambridge. So I've been placed in Bedford, and I'm quite excited to go and actually, get a bit more hands-on. I'm not really a very confident driver, so I need to go actually to the hospital, like find the keys to accommodation. So that should be fun. And basically, we've been told for like this first block we're on. So like I'm spending 4 weeks in Bedford before coming back, and then we have another four weeks based in the clinical school in Addenbrooke's. So this is called like the core clinical method, and basically the point of it is not really too much to learn lots of facts and lots of theory, but it's more actually getting used to talking to patients, because most other medical schools, their students get a lot more exposure to the clinical environment and have talked to a lot more patients. But literally, yesterday was the first patient I've like properly talked to and did an examination on. We did it at the Addenbrooke's hospital. Yeah, that was really fun. But also, I just realized how much there is for me to learn just with like the communication skills and like basic like examination skills. So yeah, I'm just looking forward to actually starting to become a little bit more competent and starting to actually learn to become a doctor. Because although there is so much still to learn, because it's spread over a longer period of time, I don't know, and it actually feels like it's more relevant to our future career as a doctor. Something tells me that I'll enjoy it more, hopefully, than the first 3 years. Although the first 3 years were interesting as well. Final thing I want to say is about like the future of the channel, because I'm a bit nervous, to be honest. As I said, it's a bit more time intensive, because you kind of have to show up to the hospital every day. Like, you can't just decide to skip a lecture, because there's the whole professionalism thing. So I'm a bit worried because, editing these videos do take quite a lot of time, but I want to like prioritize actually like learning stuff which will help me be a better doctor. So I don't want to spend ages editing. So yeah, I don't know where this channel's going to go, but I don't know. If you know anyone who is up for editing videos or helping me out a bit, let me know somehow and we'll get in touch. Anyway, that was quite a lot of waffle. I'm not sure how valuable this is, but I just wanted to do a quick life update. I need to finish loading the car and then head over to Bedford. Anyway, thank you so much for watching this video. If you liked it, please give it a thumbs up and consider subscribing to the channel for more content like this. Anyway, take care and bye for now.